Hello, this is Joe Trahan, welcoming you to the All Me podcast from the Taylor Hooten Foundation, whose mission is to enlighten the world to the truths about appearance and performance-enhancing substances. As the national leader on this subject, they communicate their educational messages through various methods, including this podcast. Thank you for listening and enjoy the show.
Hi, and welcome to the All Me podcast. My name is Tavis Piatoli, sports dietitian for the Taylor Hooten Foundation, and today I'm going to be your host. Alcohol is a very commonly consumed beverage, with over 85% of individuals have indicated they've consumed alcohol in their lifetime. Furthermore, 80% of student athletes have reported drinking alcohol within the last year. But can drinking alcohol negatively impact performance, and if so, how? In this podcast, we speak with Dr. Stella Volpe to discuss alcohol's impact on performance, the methods in which it causes muscle breakdown, how it impacts recovery, and is there a difference between types of alcohol on performance? We also asked Dr. Volpe what advice would she give her younger self, so don't miss this at the end. Dr. Volpe is a professor and head of the Department of Human Nutrition, Foods, and Exercise at Virginia Tech. Her degrees are in both Nutrition and Exercise Physiology. She is also an American College of Sports Medicine Fellow. She's also certified as a Clinical Exercise Physiologist through the ACSM and also a Registered Dietitian Nutritionist. Dr. Volpe's research focuses on obesity and diabetes prevention, and she also conducts research on all athletes at all levels. She enjoys hiking with her husband and German Shepherd dogs. She is also a competitive field hockey player, ice hockey player, rower, and works out and competes in CrossFit. We'd also like to thank our partners at Gatorade for sponsoring this podcast. Dr. Volpe, thank you so much for joining us today on the All Me podcast. It is an honor to have you.
Oh, Tavis, it's an honor for me to be here. Thanks so much for inviting me.
No problem. This is a fun topic. I say fun. I say fun because in Louisiana, especially in the New Orleans area, people love to drink alcohol, right? And today's topic, we're going to talk about the role of alcohol on athletic performance. But before we really dive into that, I know we've known each other a long time. You have a dietitian and worked in sports and sports dietitian by profession. But the first thing I really want to know, just tell listeners a little bit about your career path. What made you want to become a dietitian? And then really, where did you get some interest in learning more about the role of how alcohol impacts performance?
Sure. Well, truth be told, I always thought I'd be a veterinarian. But when I was an undergrad, I majored at University of Pittsburgh in exercise science, and then went on to Virginia Tech for a master's in exercise physiology, still not really knowing what I wanted to do. My advisor, Dr. Janet Wahlberg-Rankin, who had a PhD in nutrition, was a big influence on me, my master's thesis advisor. And so I came back to Tech and got a PhD in nutrition. And then subsequently got my registered dietitian, and I'm also an ACSM certified clinical exercise physiologist. So for me, it was always bringing together nutrition and exercise because I've been an athlete my whole life. So there you have it in a nutshell, Tavis. Hope that's okay.
And now you're back at Tech, correct?
I know. It's really, that's also an honor to come back to your alma mater to work as a department head. I'll tell you, really has been fun. Been here almost coming up on 2 years, actually. This weekend will be 2 years.
That's awesome. Yeah, I know, when people said, hey, I'm an LSU grad, and I had some rules about when I was working in sports, I was fortunate to be in the Louisiana area. And people are like, well, what if you ever got a job to go work for like the teams you grew up not liking, like maybe the Crimson Tide, or as an LSU grad, you don't work for those teams, or as a Saints fan and former Saints employee, I don't go work for the Falcons, right? So it's like, it's cool to see you back at your alma mater. I'm sure like going to a rival would probably not be fun.
Yeah, nothing against UVA, but that would be tougher. Yeah.
So definitely, no, I definitely understand that. And it's football season, so I'm excited about that. Today, we're talking about alcohol and athletic performance. Where did you get some interest in this? Because not a lot of people, at least a lot of professionals and scientists, really focus on this area.
Yes. And I have to, I want to clarify, I've not personally studied this. Most of my research is in sort of athletic performance as well as obesity and diabetes prevention. But I wrote about this as a topic for one of my ACSM Health and Fitness Nutritionist View articles, because it came up when I was teaching, whenever I teach my sports nutrition class, it always comes up, and I'm always one to talk about it very seriously. Like I don't like joking about alcohol, especially when it comes to a college setting, right? And so it came up, and one of my former master students actually had brought an article up for me to showing directly how alcohol can impact athletic performance. And I won't go farther because I know we're going to talk about that. But my interest came up because people talk about alcohol, they joke about it, and then athletes sort of embrace it sometimes. And I think it's something that we need to seriously talk about.
Yeah, it's definitely a big issue and something people may not think a lot about. I know we're going to dive into what that is today. So first, really, what's considered an alcohol beverage? Like, what is one alcohol beverage? Is the serving size different? Do they differ between like types of alcohol?
Absolutely. So like according to the dietary guidelines for Americans, I'll go quickly across some of these for you and for the audience. So beer, which has 5% alcohol, would have a larger serving, and a serving of beer would be 12 ounces compared to something like a malt liquor with 7% alcohol that is 8.5 ounces as a serving. But you go down across, and I won't say everything, but if you go down to spirits that are a higher alcohol level, like 40% alcohol, then 1.5 ounces for something like spirits or brandy would be considered a serving.
Yeah. And I know certain things will have different impacts on how we feel. We'll kind of get to that. But one of the things even when I was in college, we all partake, at least I say all, a lot of people partake in drinking. It's fairly common, but also we've read, at least I've seen some studies about binge drinking in college and as well as adults. But what defines binge drinking? Is there like a certain number of drinks that determines that?
Yes. When it comes to with binge drinking, it basically means that a person is engaging in, well, let's put it this way. First of all, a high number of athletes do, and I don't want to just put it on athletes, of collegiate athletes, but a high number of collegiate athletes and students in settings of in college settings tend to binge drink. And I want to be careful how I say that, right? I'm not trying to make that across the board. But with respect to binge drinking, for men, binge drinking would be 5 or more drinks consumed on one occasion. And one occasion equals within 2 to 3 hours. And for women, binge drinking is 4 or more drinks consumed on one occasion.
Yeah. And I'm sure in Louisiana during Mardi Gras, they exceed that pretty quickly when it comes to certain times of the year.
Yes.
So that's definitely not something that we want to do on a regular basis. All right. So we're going to get into the athletic performance side. Before we dive into really what's alcohol's impact on performance, what are some just negative effects that drinking alcohol can have just on our general health?
On our general health, so prior to athletic performance, correct? So generally, what can drinking too much alcohol result in?
Yeah,
so,
that's correct.
Okay, just want to be sure about that. Thanks, Tavis. Many things. Of course, we know its effects on the liver. So things like liver disease, cirrhosis of the liver, those kinds of things with our liver, which we know is sort of the mecca organ where everything goes through. Alcohol really affects it because it's metabolized in the liver. And then it can cause these nodules to form like cirrhosis, which can lead to other diseases. A few other things with respect directly to nutrition. When people consume more alcohol than they are consuming their regular diet, that means they're going to offset other nutrients. And therefore, they would likely be deficient in many nutrients, micronutrients. One of the micronutrients that tends to really be affected is thiamine. And thiamine can cause something called Wernicke-Korsakoff syndrome, which basically, at its worst, it can cause very, very bad dementia and it affects the brain directly. I'll stop there unless you want me to continue for a little bit, but those are some of the main sort of organ changes that we would see directly to the liver and to the brain.
Yeah, no, absolutely. That's important because I don't think people realize certain nutrients, like you mentioned, just thiamine. I've read where B vitamins are critical. I know thiamine's a B vitamin. You mentioned the impact on the liver. That's common for people to go, okay, cirrhosis, drinking, that's one of the first things that can tend to impact our important organs. Now, when we look at reasons for people to drink alcohol, I'm sure there's a lot of different reasons that impact why. I know sometimes I'll have some alcoholic drinks if I'm a little stressed or thinking about my daughter, like, oh my gosh, she's 11 and I'm stressed out. But that's not always a good reason to do that. And it's not something that we want to do on a regular basis. But what are some reasons that people just want to have alcohol?
Sure. And there are many reasons that people drink alcohol. Some of it is simply they like the taste, right? And then some of it can be, just as you alluded to, Tavis, calming their nerves, coping with stress. Maybe with respect to athletes, it might be, or not even with athletes, a social aspect, right? And for some people, it could be that it helps reduce any chronic pain that they might have, maybe pain from arthritis or muscle soreness or a chronic condition that they might have. And then a lot of people, we know that alcohol is used to celebrate. And when it's used in moderation, all of that's okay, right? But some of these issues, calming people's nerves or coping with stress, can then lead to people drinking too much and alcoholism ensuing.
Absolutely. Yeah, you're right. It's something that, you get into a rhythm or pattern and think, oh, I'm just going to use this now instead to solve that problem, as opposed to maybe I should go exercise, eat well, sleep well, and not look for ways to kind of put a Band-Aid on some of those things. That could become a pretty serious addiction.
Exactly.
Now, we're going to dive into the athletic performance. So I'll break this up a little bit so we don't, I know I can say, oh, what does it do for performance, right? Because performance is a big word. The first thing I want to kind of dive into with you is just the impact on muscle tissue and drinking alcohol. So can drinking alcohol impair muscle growth or muscle recovery? And if so, how does that happen?
Absolutely. And so, again, there was a really great study, there have been a number of studies. And one of the studies that was conducted down in Australia by Parr et al., that they evaluated, it was a smaller study, but they evaluated alcohol consumption in 8 physically active males. But what made the study so strong is that they took muscle biopsies 2 and 8 hours post-exercise. And what they did was they immediately post-exercise and 4 hours post-exercise, they had these individuals consume one of 3 drinks, and it was crossover design. So all of them had all of them had the same drinks, but of course they had a washout period in between. And so they either got 500 mils of whey protein, or they got alcohol with whey protein, or they got alcohol with a carbohydrate. And they with these muscle biopsies, what they found was in individuals who had alcohol plus the protein post-exercise, they had a 24% reduction in their myofibrillar protein synthesis, or their muscle, how we measure muscle growth. And those who just had alcohol with carbohydrate had a 37% reduction in this myofibrillar protein synthesis with alcohol and carbohydrate. I say that because if people now just drink, so it's bad enough, right? The significant reduction that they had in muscle growth, 24% and 37% with protein or carbohydrate respectively, those were significant. So imagine then if someone has alcohol without any of that, or binge drinks post-exercise, that percentage will increase greatly. So anything positive they would have gained from that physical activity is gone. Nothing will have been gained from that activity.
Now, can you just give our readers, listeners, just a little bit of a brief of what protein synthesis is?
Oh, sure. I'm so sorry about that. Yes. So when we talk about protein synthesis, and in particular, myofibrillar protein synthesis, we're looking at the myofibrils of the muscle. And that's where we see actually muscle growth. That's where we would see strength happening. So any of this myofibrillar protein synthesis, so where protein is being laid down to help increase muscle, but most importantly, that leads to increased strength. So when we talk about the reduction in that means that we will not have any gains in strength. As a matter of fact, we're going to have some loss in that, any gain of muscle mass and loss of any gain of strength that would have accompanied that.
Yeah, and something I want our listeners to understand is, like, typically when we're educating athletes, what we want them to do is right after they're done their workouts, because during the workout, it's, protein synthesis actually is exceeded by breakdown. So there's more muscle breakdown. But when carbohydrate and protein is consumed after that workout, protein synthesis is elevated. So, that means our muscles are going to recover faster, rebuild, repair. But what Dr. Volpe is saying is when you consume alcohol during the day or even after a workout, that protein synthesis drops and your body is breaking down tissue. Is that correct?
Exactly.
Yep.
So, and maybe another way to put it, Tavis, if it's okay for some of the listeners, like think about anabolic response, right? So anabolism is growth. You're not going to have anabolism. The alcohol consumption suppresses that anabolic response and may impair your recovery too, as well, and your adaptation to training, or it may also impair your subsequent performance. So all those need to be taken in consideration. I'm sorry to interrupt you. Go ahead.
No, not at all. That's great.
Well, I was going to I'm so sorry. I should know to just stop for a second. But I guess the one thing I want to emphasize is, I tell my students this often, that if you're in a single sport and you do this and you're impairing your own performance, that's still bad, right? Because even track and field, their team points, right? But when you're in a team sport and you do this, you're not only affecting you, you're affecting your entire team. And so to think about the negative impacts it has on you as an athlete, and then the negative impacts that ripple effect that it would have on your entire team.
Gotcha. Yeah, no, that's a great thing to point and for people to understand, is that they're part of a team that, requires points, as a collaborative effort, like you said, track and field, or any team where it's a team effort. Even if it's a tennis where you might be performing in singles, but the fact that if you win or lose can determine if your team advances in the tournament, that's important. Now, when we look at alcohol, is there a specific volume or frequency where this has an effect on muscle, or can this happen even in small quantities?
It can happen in small quantities. I mean, obviously, if someone, and I'm going to say this very carefully because then I'm going to follow it by saying what I would still recommend. So if someone had, say, a beer after they worked out, they're still going to see a decrease. So one beer would, as I told you earlier, that's a serving. If you have 12 ounces, you're not binge drinking, but that still will lead to a decrease in myofibrillar protein synthesis. However, my recommendation would be, if you're of age and you want to drink after working out, my recommendation is first consume a sports drink and have some carbohydrate mixed with some protein within the 2 hours post-exercise, because as you and I know, Travis, that's the key time to replenish your glycogen synthesis, your glycogen stores, right? And that can help with muscle recovery as well as myofibrillar protein synthesis. Then post that, if you want a beer or a glass of wine, then that's when I would suggest, again, a person of age would be able to consume it and not see the losses that we see in some of the research that has been shown right after exercise when alcohol is consumed.
We talked about volume. Let's talk about type a little bit. And I've seen, somewhere where some people say, oh, it's better to drink wine versus liquor, or maybe have a few beers instead of liquor because of the volume or alcohol percentage. Now, is that true? Does alcohol type have any relevance to when we're talking about the recovery of muscle, or is it all alcohol is going to impact you no matter what?
I'm going to blanketly say all alcohol will impact no matter what. However, it seems that the alcohol that has the higher percentage of alcohol content, i.e. things like liquor, spirits, etc., would have a greater impact because your body is trying to get rid of that alcohol as quickly as possible. So the alcohol dehydrogenase is working even harder in the liver. So, I want to be careful how I say that to your audience, because I want to be careful how people take this. So, a beer would be would be somewhat, not far, but somewhat less harmful than something like, a shot of tequila. Right?
Well, yeah, I'm sure like bigger people, people with small mass, higher muscle mass, body weight. I'm sure the way people metabolize these things also have an impact on that. I would think like a 320-pound offensive lineman versus a 110-pound gymnast are probably going to metabolize alcohol, I guess, a little bit differently.
Absolutely. And at the same time, I do want to be careful, right? I still want to profess, let's have some sports drinks, a good little recovery meal or snack within the first 2 hours. Then if you want to go on and have a beer and maybe with like a meal after that, it'll be still better to do that to prevent the losses that likely you're going to have. But you're absolutely right. so as you know, so many things come into consideration with far as size, gender, but while I have sort of the floor here still, is that we know that alcohol affects women and men equally, the same as far as affecting their muscle protein synthesis and their recovery.
Excellent. Okay. Well, let's one of the things I've heard, at least I've read and I've talked to athletes about this in the past, is just about that one night of heavy drinking, right? You may be part of a strength and conditioning program 5-6 days a week, just really grinding it out. And then you go out one night and just tie one on and drink so much to where you just feel awful. Could that one night of heavy drinking offset a lot of that progress, especially when you talked about the impact it has on muscle protein synthesis?
Yes. And in some ways, that binge drinking is going to affect your body more greatly than if, say, if you were a person who might have a beer or a glass of wine per evening. Because once again, you think about all that your body has to do to rid itself of that alcohol. I'm going to say it simply, even though this isn't exactly the way it's working, but and I know you know this and listeners know this, but think about all the processes or the vitamins and minerals that are involved, say, in muscle myofibrillar protein synthesis that might now need to be diverted to the liver to then get rid of that alcohol. They're not doing the job that they were maybe meant to do, or at least less of them are being used for myofibrillar protein synthesis. More of those systems are trying to metabolize that alcohol. So the gains that person may have had would be certainly gone if they had a very big binge drinking than had they just, again, recovered nicely and then had one beer, for example, afterwards.
Yeah, no, absolutely. Listeners, now with Dr. Volpe saying, this is not your bank account. Don't put all your money and save it all for the weekend. So it's like have a glass or two of wine or a glass of wine a night versus 7 or 8 glasses on Saturday, because that's going to negatively impact that outcome. All right.
I really like your analogy, Tavis. Thanks for that. I hope I'll use that someday. I appreciate that.
Yeah, I talk a lot about that when it comes to like calories. Like, you don't want to, it's like saving calories is kind of like a bank account in a way where, if you want to put a little bit on the side or move some food around, that's okay. You don't want to like skip too many meals during the week and go in a massive deficit. And then like on Saturday, you go, I'm going to eat 3,000 calories versus 15. That's probably going to play a little catch up on you there.
Yes.
Now, in Louisiana, there's beer after most races. And years ago, I used to participate in triathlons. It's been about probably 11 or 12 years. And it was kind of funny because after my first triathlon, there are people blending margaritas. And I'm like, you're kidding me. Like the last thing on my mind is thinking I want anything with tequila in it. But people are just drinking these like no big deal. So we talked a little bit about the recovery and the protein synthesis side. What happens, like, let's say someone has a big race and then they just drink a lot of alcohol, and how does that impact just the recovery from the endurance side? Or just, is there anything like immune system, inflammation, anything that they should be concerned about?
Yeah, I would actually say that they could be very concerned about many things. So we talked about myofibrillar protein synthesis, and people are probably tired of hearing me say that. Some other things that can happen if someone has alcohol, and I'm amazed that anybody would want margaritas post-exercise, but especially, and I've done triathlons many years ago as well, Tavis, and that would be the last thing I was thinking of too. But one of the things is that they'll get reduced muscle glycogen synthesis, meaning that they won't have that recovery of the glucose put back into their muscle as glycogen. So that recovery is not going to happen. Cognitive function can get affected immediately and even from in the day after. And their sleep will be affected. Their sleep quality will be affected. And I know you talked about endurance athletes, but the other thing that also affects athletes would be their peak power. And some of the other things, one of the things that I'm sure people are waiting for me to say is dehydration. So alcohol, yes, is a fluid. Yes, if you drink it, you get some hydration, but your body tries to rapidly get rid of it. And so it will cause dehydration as well. Some of the other things that can occur with, like, we know that It does decrease endurance performance. It does decrease repair and recovery. And most people realize too, especially if they overconsume alcohol, that they will have impaired motor skills because their central nervous system gets depressed. And then there's a hormone imbalance as well. In particular, I will say that cortisol concentrations increase, and they're associated with protein breakdown. And alcohol decreases testosterone secretion, which would then interfere with any adaptive processes with, say, muscle recovery, et cetera. I know I probably gave you too many there, but I hope that was sufficient.
No, that's great. I love the fact that you said, hormones, looking at things like testosterone, growth hormone. Those are things that, especially certain listeners, that when they're attracted to building muscle and getting stronger, that's something that's very important is to know is this could inhibit growth on the testosterone side, which is a critical hormone when it comes to muscle building. So that's important to know. Now, you mentioned sleep. That's actually my next question, because we know sleep is a critical piece of the performance puzzle when it comes to recovery. How does alcohol have an impact on sleeping patterns? Like, what is it that it does to impact or interrupt someone's sleep?
Yeah, alcohol basically leads to fragmented sleep. So it disrupts that sleep onset latency, your restorative sleep cycles, and the rapid eye movement or REM sleep. So it really affects deep sleep, which when people don't get their deep sleep, we know that can lead to many things. One, poor athletic performance, but then also from a chronic disease standpoint, it could lead to things like high glucose concentrations leading to diabetes, increased risk of heart disease, and also increased risk of, just general inflammation and autoimmune diseases. So those are things for people to consider. Tavis, you and I, and probably most of the people listening to us, know how important sleep is. And I know that many of us don't always get the sleep that we need. However, alcohol directly impacts that in our bodies. And so thinking about how that might affect one's sleep and how that will then lead to decreased performance, both in athletics as well as in the classroom or at work.
Excellent. Yeah, that's me. I'm just getting older and I have to wake up in the middle of the night and go to the bathroom. So it's just like, I'm just getting to become an old man. And it seems like if I can get those 5 hours before that happens, I'm good. And then trying to go back to sleep, it's like, oh, I start thinking about what I have to do for the day. And then it's like, I'm just going to get up. So,
Tavis, yeah, it's true though. I know as we get older too, it's more difficult to have that. You feel happy with 5, don't you? I mean,
well, and then I watch my daughter. She's like, she's about to go back to school next week. But then it's like one day she slept until like 11, and I'm like, you slept 12 hours. I was like, I haven't slept 12 hours since maybe I was your age. So it's just like, just getting 8 hours to me is like a massive win. I would love to get 8 hours. All right. So let's talk a little bit about on the medical side of things. When we look at how alcohol impacts our health, are there any specific lab values that someone can get measured that determines if alcohol is actually, causing a negative impact on their health? You mentioned liver, but what about some blood work that we could look at?
Yeah. So some of the blood work that you would look at with alcohol consumption would certainly be, as you said, the liver function test. So ALT, AST, right? And those are the ones that often, people would be able to evaluate if someone has sort of a liver dysfunction or et cetera from alcohol, over alcohol consumption, if you will. And some of the other ones would, I would say included things like, some of the other ones you would think about too, you might want to, we would have tests, for example, some of them would be very specific for what alcohol does. So alcohol can also cause fatty liver disease. So we would look for things like high cholesterol concentrations, high LDL or low density lipoprotein concentrations, those kinds of things. We'd likely see hyperglycemia as well. And so obviously, we would look at for things like blood glucose concentrations. And the other thing that I mentioned earlier too would be cortisol concentrations. Now you have to be a little bit careful with that because that can show other things. But and there are other ones that, for example, people can evaluate something like mean corpuscular volume, because that, even though that can result in identifying if someone just recently had alcohol, that can help us identify, if they're not really, telling us whether they've been drinking a lot, et cetera. But that can be one. I think those are, well, there's definitely more, but those are the ones that come to mind to me right now. But I know that there are definitely more that could be assessed. And, the one that I said earlier that probably isn't assessed as often, but should be, is thiamine. So our thiamine concentrations in our body as well.
Excellent. Now, we talked bad about alcohol, right? That was the point of this, is to give our listeners some information about the side effects, the harm, what it does on alcohol performance. Let's talk about, because we know there are some benefits. When we look at athletes, especially if we consume this in moderation, are there any benefits for drinking alcohol for athletes, just for health, maybe even not saying performance, because we don't want an alcohol to say, let's have a beer and go run, and participate in the race, but just for general health. Are there advantages to maybe having a small amount of alcohol?
Yeah, there are. I mean, so first of all, I start by saying that if someone doesn't drink, when I talk about some of the advantages of alcohol, I don't encourage people to drink, right? So as I know, and I know that you're asking me that not because, you're telling people, hey, let's go have a drink, right? But there are definitely some benefits. So one of the benefits, and especially you hear the benefit of, say, red wine, might be that it can lower your risk of cardiovascular disease. So a glass of wine every evening, might help to increase our good cholesterol, the high density lipoprotein cholesterol. That's one. Some studies have shown that alcohol, again, not a high consumption, but sort of one of those, when you have like occasionally drinking a couple times a week, that it can actually lead to a length of life. Now, I want to stop by saying this. Some of those studies with alcohol lengthening a person's life typically are associated with those countries that consume the Mediterranean diet, right? So it's also a part of their lifestyle. You and I, both being Italian, know that there's that big lifestyle with the Mediterranean diet. It's not just the diet, it's the fact that there's other things that go along with that diet that also help to increase their lifespan. So I just want to make sure I say that. Yeah. And now some of the other things, that some research has found, but it's also, I want to be careful how I say this, because again, not all research has found this, that, it could reduce somebody's risk of having gallstones. Why that is, to be honest with you, I don't know that mechanism. And one, maybe two studies show that it could lower the chance of diabetes, but you and I both know that it could actually increase the chances of diabetes because of the risk of hyperglycemia with increasing alcohol consumption. So that's all in moderation. And I know that's what you asked me, but I just want to make sure I repeat that for our audience, that this is not any binge drinking that's going to help with positive effects.
Somebody's going to take it and go, she said I can have all the beer I want. I'm not going to have gallstones.
Exactly. That's what I want to make sure is not being heard.
It's funny you say that, because when I was working with Tulane Athletics years ago, I said something, and just, obviously I told the student athletes, look, I gave them an example of what someone did to lose weight or something. And I said, this is not something I ever recommend you practice. Well, a coach came to me and said, one of the athletes said you mentioned this. And I was like, wow, of all the things we went over, that was the main takeaway. So they heard what they wanted to hear out of that, right? You can kind of twist it where, you say something and they're like that, they heard what they wanted to hear out of that. All right. Exactly. Dr. Volpe. Oh, and one thing I mentioned, it's funny you say that, because I've been watching a lot of stuff on longevity, and we know with red wine, resveratrol, but in listening to a professor of anti-aging talk about resveratrol, it was really interesting. He said, to truly get about 500 to 1,000 milligrams of quality resveratrol, you'd probably have to consume about somewhere between 1,500 and 2,000 glasses of red wine, which instantly you would never get to that level. You'd be dead way before that. So it was really like, okay, I'm just going to take resveratrol. I'm probably not going to try to get it from red wine, because it's not going to be nearly enough.
You're right. You're absolutely right with that. And actually, I remember you and I discussing this. when I presented for you a month ago, and it's so true. I think there are, other benefits of red wine that, even when we think about resveratrol, at least some of those antioxidant effects of it.
Yes.
But what else? I mean, again, I just want to make sure I say this. If you don't drink red wine, you can get it from grape juice, right? You can get it from other things. And you and I, again, both of us know this, and maybe many of our audience listeners know this. We can get antioxidants from so many things that you don't have to go to red wine. That's not the be all end all if you're not a wine drinker.
Right. Absolutely. All right. Last question, Dr. Volpe. If an athlete is going to drink, or even anybody in general, if they're going to drink alcohol, what would be your recommendations for them to where this can be done safely and it doesn't impact their health or performance?
Absolutely. I'll go back to because I know I brought this up a little earlier, and that is, if you're going to drink, first of all, don't binge drink. And I don't like to, be on this podcast, like pointing my finger to people, like, don't binge drink. But honestly, for your overall health, it would be great not to, right? But I don't want to sound like this person who's, okay. But I feel that it's my responsibility to say that, that binge drinking just doesn't benefit anybody's health or anybody's performance, for that matter. Cognitively, physically, it does not help. So if you're going to drink, having, say, whatever the sort of recommended amount per day that recommended by the dietary guidelines for Americans, and also, again, post-exercise, that would not be the choice to have alcohol for your recovery. And I know there are many athletes listening to us right now saying, but beer has carbohydrates. And I know that it does, but it still has alcohol. And unfortunately, the alcohol outweighs any benefits of the carbohydrates that are in that beer. So what I will tell folks again is, hydrate properly with a sports drink or water, and energy chews or something like that, and have a little snack. Couple hours later, after you've had a nice, that nice recovery, so that your glycogen can be refilled, that your muscle protein synthesis can start to work on the positive end, then have that glass of beer or glass of wine and enjoy that with a nice meal, and drink it nicely and slowly, and don't, sort of guzzle it down. And I think likely if you do wait, you'll probably enjoy it a heck of a lot more than you would have anyway.
So athletes, do not put protein powder in your beer and consume it after your workout, because that is not going to be ideal for recovery.
Thank you. I appreciate that. Right.
All right, Dr. Volpe, this was fantastic. A lot of incredible information, but I'm not done with you yet, because although you have questions that we went over when it came to the podcast and alcohol and performance, now I have what's called our curveball round. You don't know what I'm about to ask you, but the good news is it's 3 questions, and it has nothing to do with today's topic. It's just fun stuff that we do after every podcast, and kind of surprise our guests with these questions. So are you ready for just a few fun questions?
Yes, this is really fun, but
right.
You made me relax knowing that it's like not going to be, it's just going to be fun. All right, go ahead.
It's just fun. All right. So first question is, I ask every single guest of mine this, because I love music as much as I love anything else when it comes to hobbies and things like that. So if you had the ability to be the lead singer of any band, whether it's they're no longer existing or you still enjoy watching them today, who would that be?
Oh man, I've got several. It's just too funny that you asked this, because this morning at CrossFit, my trainer's like, Stella, what do you want me to play? And I'm like, because I was the only one there this morning, and I said, oh, Billy Joel or Elton John. So either of those, but I'm going to go with, because you said band, and I'm going to take that to what you mean. And Earth, Wind, and Fire. They'd be so much fun.
Nice. Okay.
Probably half of our audience don't remember them, Tavis, but I know you and I know.
No,
I would have fun with them. Yeah.
They've played what's called the Endymion Extravaganza. That's a massive parade during Mardi Gras. And then that parade moves into the Superdome and it parades around. And then there's bands from, a lot of massive bands over the years. I think Earth, Wind, and Fire headlined one year with bands like Kiss and, all kind of different genres that perform every single year. All right, question number 2. What is Stella going to be doing when she retires? What are your plans? And I'm not saying that's coming soon, but I just kind of want to have an idea. What's when work is like, I'm done with work, what are your things that you enjoy doing that you plan on doing with post-retirement?
Yeah, I'd love to continue all my sports. And, as they say in the South, God willing, and the creek don't rise, Tavis. I would, to continue sports, to obviously, adopt more and more dogs. If it weren't, my husband always kind of keeps me at bay. I'd probably have 10 adopted dogs. So I would, and I would like to volunteer in animal shelters. And I would actually like to get a certificate in animal behavior. I want to learn really learn in the science of animal behavior.
That's amazing. I saw pictures of your dogs in your profile, and it's just, they're just wonderful animals. They're fun to be around, especially if you have good, loving dogs, which most people do. They're like your children, and it's so much fun.
Yes.
Last question. And this one's probably going to be a little bit challenging to make you think about it, but what is one thing today's Stella would go back and tell young Stella?
Wow, what a good question. What would something today Stella would tell young Stella?
If you could go back, let's say 30 years, or when you were a student in college, what would you tell yourself?
I would tell myself, wow, Tavis, I would that's really, really good. You've really got me thinking. I think I would tell myself to focus more, so if you're thinking like taking me back to college, like maybe undergrad, I would say, think more about the bigger picture of when you're learning and the connections, and not so much like each class and the grades of each class, and focus. I tell my students this: focus more on the journey and not on the end product, because it's always a journey.
Right.
And so that's what I guess I would tell my young self.
Yeah. They asked me that, and I was just like, oh no. And my answer was, I'd go back and invest in Bitcoin.
You would invest in Bitcoin?
It's like, I'd go back and say, get investment in Bitcoin now before it goes to $25,000, $30,000 or $60,000 per share. So
that's great.
It was tough. It's a tough question. It really is.
It's a tough question, but it's a great question. And I might use that. I appreciate that one. That really got me thinking. Thank you.
No problem. Stella, always awesome and fun to talk to you. Just always like a normal conversation. And also just high quality information for our listeners. I know they've enjoyed this podcast and they've enjoyed the things that you shared. And hopefully they'll take this information back with them when they're like thinking about what their goals are. And if alcohol is impacting their goals, maybe we'll make a difference in their lives and help them make some changes. So thank you so much for sharing your knowledge and expertise today.
Tavis, thank you. It's always a pleasure. And you know that anytime you ask me, I'm going to say yes. So I am really grateful that you wanted to interview me today. And I want to thank the audience for listening. And thanks again.
Awesome. As audience, thank you so much for listening to the All Me podcast. Have a wonderful day.
Well, that's it for today's show. Thanks for listening to the All Me podcast from the Taylor Hooten Foundation, a nonprofit organization leading a national campaign to enlighten people to the truths about appearance and performance-enhancing substances and inspiring people to live and compete without the use of these substances. Please be sure to subscribe to our podcast and tune in to our next episode.